Errol Barnett is traveling with the president. He joins me now from Branchburg, New Jersey. And Errol, there are two major points of contention with this health care bill. States can opt out of pre-existing conditions coverage, and Medicaid funding is slashed. Are Senate Republicans essentially going to start from scratch?
Well, Senate Republicans, DeMarco, say they will, and that's why they've convened this working group, these 13 senators who will essentially look at the House bill, remove what they dislike, and try and add and change what they believe will assure its passage in the Senate so it can head to the president's desk to become law. But Republicans in the Senate are only looking for about 51% support in that chamber. They're not banking on any Democratic votes at all through this process called reconciliation. So it will be perhaps weeks, likely months, before we see any draft text to really gauge what the Senate bill looks like. Still, President Trump says he is confident that the Senate bill will pass and that Americans will have a type of, he's not calling it Trump care, but Democrats certainly are, a type of health care that he says will lower premiums and lower deductibles. That is a very tall order, but while the president spends time at his Bedminster, New Jersey golf property, not too far from where I am, he will be working in ways to make sure that remains the case. He said this has so far brought Republicans together. It's been true in the House. He hopes that that will continue in the next few months in the Senate.
Well, the Senate has promised to take its time with a revised version. How much is health care going to impact next year's midterm elections?
Well, Republicans and Democrats know by now that health care, the potential reform, will be the main driving issue in midterm elections as far as generating each side, generating the base of each party to come out and vote. A new Quinnipiac poll found that only 17% of Americans have a favorable view of the House bill. So you could say that the bill so far is about as popular as a root canal, and that is before the Congressional Budget Office has even scored it. So we don't know how much this bill will cost. We don't know how many Americans could potentially lose health care coverage because of it. And if you remember, during the first attempt in the House, it was the CBO saying that more than 20 million Americans could lose their coverage. That really scared a lot of Americans, and specifically those Republicans in the House, who eventually were not able to endorse the bill. Once those things have been scored, you'll get a sense of who really is behind it, and that's why you're starting to see some Republicans distance themselves already, House Republicans, from the bill, indicating that perhaps they didn't read the whole thing, telling their constituents, look, the Senate will change some of the most unpopular parts. They want to be able to tell their base, look, at least we tried to deliver on our #1 campaign promise, while Democrats will use those images of Republicans standing next to President Trump, plus whatever we might get from the CBO, how much it will cost and who may lose coverage, to challenge vulnerable Republican seats and hopefully for Democrats gain a majority in the House. The reverse happened when Obamacare was passed years ago.
It is clear the fight is not over on both sides there. Later this month, just want to switch to another topic. President Trump will visit Saudi Arabia, Israel, and then Rome. What's the White House hoping to accomplish on this trip?
Well, this is a very big deal. The White House essentially wants to be able to articulate what President Trump's America First policy means to U.S. allies and the rest of the world. He will be visiting what the White House describes as 3 different representations of faith through Islam, Judaism, and Christianity, and going to Saudi Arabia, Israel, and Rome. In Saudi Arabia, the expectation is the president will hope to speak with regional allies about ways in which they can have combined efforts to defeat ISIS. The same is true in Israel, when the president has openly said he doesn't know why the Israeli-Palestinian conflict hasn't been solved in the past. It's perhaps not as difficult as people describe it to be, so it'll be interesting to see what the president presents during that leg of the trip. And we expect the president to meet with Pope Francis, a man who himself has been outspoken on many issues beyond politics. So the White House wants this to be not an opportunity for President Trump to outline specific solutions, but to say America First policy means that the U.S. president is a disruptor. He respects previous alliances, but is in no way bound by the status quo, and is willing to think outside the box and potentially find new solutions to old problems.
All right, Errol Barnett traveling with the president. Errol, thank you.